first. If you're a Seinfeld fan, chances are you've seen this memorable episode where Elaine happens to catch a glimpse of her medical record and then hatches a plot with Kramer to steal the chart from the doctor's office. Remember that? So that you can read everything that's been scribbled on it.
Get in there, get the chart, and get out. You got it?
Yeah, no problem. One chart coming up.
Okay. Where's my chart? Did you get it?
No.
What? What happened?
I don't know, but now they got a chart on me.
Well, in real life, thankfully, you don't need to steal your chart, but it can be a challenge. Some doctors make you fill out a form, then fax it or mail it or hand deliver it to the office just to request your own record. And they may not give it to you digitally either. Other times, though, it can be as easy as logging into a patient portal and downloading your records onto your device. You want to give it a try? We're going to give you some hints on how to do that. Here to talk about your rights and how you can get your records onto that health app on your phone, and some of the innovations underway aimed at getting your digital records to you are Christina Farr, senior writer at Fast Company in San Francisco. She joins us from the TED-Med conference in Palm Springs. Welcome to Science Friday.
Thanks for having me. This is one of my favorite topics.
Well, thank you. Erin Mackay is coordinator of Get My Health Data, an initiative that advocates for patient access to digital health records in Washington. Welcome to Science Friday.
Thanks very much, Ira. I'm excited to chat with you.
Oh, it's good to have you, too. Christina, you wrote a story about the CEO of a health IT company whose own wife had a terrible time getting her own medical records and sort of changed things for him.
Yes, that was a fascinating story to write because this is someone who, is the CEO of one of the largest health IT companies in America. And when his wife got sick, I guess everyone becomes a patient at some point. She had to carry around her medical information in paper bags. And I had a very honest conversation with him last year when I wrote the story, and he was really taking a look and saying, what more could I be doing to fix this situation, to make sure that all patients have easy access to their medical information and that it's digitized.
Mm-hmm. And Erin Mackay, for most people, is it that much of a hassle? How far have we come from that Seinfeld episode?
Well, that Seinfeld episode actually aired the year that HIPAA took effect, and particularly the law that gave patients access to their health information. But unfortunately, it still continues to be quite difficult for patients to navigate the records request process, and particularly to obtain, as you say, digital copies of their health information. I think there's a lack of understanding of the rights patients have to this information and providers' responsibilities to make it available. And so that is what Get My Health Data, an initiative of the National Partnership for Women and Families, has been looking into for the last year. What is it like for people on the ground to request their medical records, and what barriers do they often encounter?
Mm-hmm. I encountered one barrier when I wanted an X-ray from my doctor, and he gave me actually gave me a little disc, and I brought it home, and I couldn't read it. I didn't have a format translator for it.
Yeah, unfortunately, most laptops and computers these days aren't sold with disk drives, and that is one of the ways that digital copies are often made available. Digital burned onto a drive or perhaps in a PDF. And while that's a great start in terms of getting electronic data to patients, it's not available in the sort of structured file format that would make it possible to upload into a health app of a patient's choice, for example, to make it easier to organize data and compile data from different doctors and hospital settings, because many patients have their data sort of strewn about different institutions, and it would be great to give them a complete consolidated view of their health history.
Christina, are big tech companies like Apple and Google working to make this easier for patients?
Yes, and that's been one of the sort of big areas of optimism in the past 5 years or so, is companies like Apple, which you wouldn't really associate with healthcare, even a few years ago, have made a big push into trying to get this medical information to patients. They've released things like HealthKit, which is one of their sort of interfaces that aims to bring together the medical information that you might get from a provider, like your lab history and so on, and combine that with the types of information that patients are now collecting themselves. So if you have an accelerometer on your iPhone, or maybe you're collecting your blood pressure or heart rate, all that information can now be combined together on a smartphone. But of course, the challenge remains, much of this information, as has already been discussed, it's just not machine readable. It can't be read by a computer. And that continues to be a major source of frustration.
Mm-hmm. Are there small startups that know this and see that there's money to be made by getting an app that will read all these different things that you can download into it?
Absolutely. I actually tried one recently called Technic Health. You pay them a fee, and they will go out and try to get all of your medical records from all of the different hospitals and health systems that you've ever been to throughout your life. So that doesn't mean it's going to be perfectly aggregated information, because they still might claim that they've lost your record or they can't find it. But it's just on one level it's like great that these startups exist. On another level, it's this information, we have the right to have it. Like you shouldn't have to pay someone else to go out and find it for you. But we're still at that point, and we certainly haven't reached this holy grail of true interoperability or data sharing yet.
Well, let me ask both of you this general question: then, do you have a right? Should your doctor, is he or she forced to give you your records if you demand them?
Absolutely. Patients unequivocally have a right to a copy of their medical record and other health data, and that now includes a digital copy of that information if the doctor has the capability to produce it electronically. So, patients aren't necessarily asking their doctor for a favor for copies of these medical records. They should, they're no longer difficult patients, as in the Seinfeld episode. They are simply asking for what they have a right to. And also I would note that, empowering patients with this kind of information to help them make decisions, to set and track goals, to share information, as Christina says, that they have about their health status and their symptoms is particularly important.
I've had doctors tell me, I think it's a great idea to share information, but I'm fearful of putting your records out on the internet.
Yeah, I've heard that too, and there was a great program a number of years ago called Open Notes, which is still ongoing. This idea that we should be sharing clinicians' notes with patients, so maybe you can even find out if you are a difficult patient or if there's something wrong in your medical record. And one of the fears that I heard from doctors early on around that is, how is a patient going to react if they read that I've written that they're obese, or they might confuse a medical term like SOB. And once the pilot and the trial was rolled out, it turned out that was really a rare occurrence, if at all. Like, patients seemed to really be very receptive to this kind of information, and they didn't see much pushback around it.
So Erin, what should a patient do? Let's say you're starting from zero, and you want to get your medical records. What steps should I or anybody take?
I think first and most important, it's important to have an understanding of what your rights are. And we offer a lot of tools and resources on getmyhealthdata.org to help you understand what your rights to your medical records are, how to navigate the request process, and then I think very importantly, what to do once you get that data. I think that's another important piece is once you understand your rights, once you make the request and hopefully successfully receive your data, you need to be thinking about a safe and secure place to store it. There are a lot of apps on the market that either will go out and make the request for you or provide a place for you to store and organize your data. But there's a lot of variation in how apps or medical devices use, share, and protect health information. And so I think it's important that we start doing a better job telling patients about these, apps, data sharing policies and practices in a transparent and understandable way so that consumers can make these decisions and feel confident that they have easy and secure access to their data when they need it.
Well, let's talk about that a bit, Christina. I mean, there are people, I'm sure, who are going to feel insecure that hackers are going to go get my information and either sell it to someone else or hold it for ransom or blackmail me or whatever.
Yeah, and this is a serious consideration. I was recently invited by IBM's security team to take a tour of the dark web, which is a place that sort of hackers can go and do not very legal things in a lot of cases. And I saw a lot of medical records up for sale. These medical records are the new credit cards. So, hospitals have not been rated particularly highly in the past for their security practices, and I think, in the next 5 years, we're going to see increasing pressure for them to, be as secure as, say, other industries that manage sensitive information, like the financial sector.
Well, that's what hackers have told me, that we don't have to hack into the hospital because it's so insecure within the hospital itself, it'll leak out.
Yeah, I mean, I've even heard of cases where, some of this information gets faxed, it gets left there for a while, and anyone could just walk past and pick it up. And that's pretty scary that something like that could happen.
Mm-hmm. Erin, any idea if the whole healthcare technology space might change much under this new administration?
Well, I think the good news is there is a great amount of attention to the role that health data plays in, as I said previously, empowering consumers to take a greater role in their health and in their health care. And I think that's a goal that is agreed upon by both the old administration and the incoming administration. Luckily, the issue of health IT, health information technology, has long enjoyed bipartisan support. And recently, actually, just yesterday, the House of Representatives approved a sweeping medical innovation bill that included some provisions related to health data and interoperability, and particularly around increasing patient access to their data, to longitudinal records, so a more holistic, comprehensive view of your health information, and also in a computable format, which, as Christina mentioned, is really critical to making the data that we have more actionable and useful in both the daily lives of patients, but also for providers.
Yeah, and a good place to start might be at Get My Health Data.
Absolutely. We would love for you to take advantage of our resources and request your medical records and share your experience so that we can work with the system overall to seek improvements.
Erin Mackay, coordinator of Get My Health Data and initiative advocate for patient access. Also, Christina Farr, senior writer at Fast Company in San Francisco. Thank you both for taking time to be with us today. Have a great weekend.